Today, we're going to tackle a term that can sound pretty intimidating during pregnancy, oligohydramnios. We're going to break down exactly what it means, what causes it, and how doctors manage it. Our goal here is to turn some complex medical info into something that's really clear and easy to understand. So let's dive right in.
And that's really the heart of the matter, isn't it? The amniotic fluid is literally a baby's entire universe in there. It keeps them safe, it helps their little lungs develop, and it gives them room to wiggle around. So you can imagine, when that world starts to shrink, it's a signal that doctors need to start paying very close attention.
So before we can really dig into the problem of low fluid, we've got to understand the amazing job it does when everything is going just right. Let's start with the basics of this incredible personal life support system.
Now, this might sound a little strange, but it's true. For most of the pregnancy, that protective liquid is made up almost entirely of the baby's own urine. But don't worry, it's completely sterile and absolutely vital for creating that safe, cozy space for them to grow.
And what's really fascinating is that this isn't just a stagnant pool of water. It's a constantly moving, recycling system. The baby actually swallows the fluid, it gets processed through their kidneys, and then they pee it back out into the amniotic sac. It's this dynamic, living environment that's constantly refreshing itself.
The amount of fluid in there also changes in a pretty predictable way. It usually keeps increasing until about 33 weeks of pregnancy. Then it kind of hits a plateau for a little while, and then it naturally starts to decrease as the due date gets closer. This whole pattern is a really good sign of a healthy pregnancy.
Okay, so now that we've got a good picture of what's supposed to happen, we can talk about what happens when that delicate balance gets thrown off. And that brings us to the condition itself, oligohydramnios.
So at its core, the definition is pretty straightforward. Oligohydramnios is just the specific medical name for when the amount of amniotic fluid is lower than it should be for how far along the pregnancy is. But that begs the question, right? How low is too low?
Well, in the medical world, low has a specific cutoff. It means the measured fluid level falls below the 5th centile. You can think of it just like a growth chart for a baby's height or weight. If you lined up 100 pregnancies at the same stage, having fluid levels in the bottom 5 would get you this diagnosis.
So how common is this really? Well, it's diagnosed in about 4.5% of full-term pregnancies. So while it's definitely something that needs to be monitored carefully, it's also a condition that medical teams are very familiar with.
So why does this happen? Well, the causes almost always come back to a problem with that fluid recycling system we talked about. The two most common culprits are either that the container has a leak, meaning the membranes have ruptured, or the supply line isn't working right, which can happen with placental problems that slow down the baby's urine production.
Okay, this leads us to a really important question. How do doctors figure all this out? If there's a concern, how do they confirm the fluid is low? And just as important, how do they find out why?
The number one tool for this job is the ultrasound. It's a totally non-invasive way for doctors to get a clear look inside and actually measure the pockets of fluid all around the baby. Now, they don't just eyeball it. Doctors have two main ways of measuring. The most common one is called the Amniotic Fluid Index, or AFI. For that, they measure the deepest pocket of fluid in 4 different sections of the uterus and add those numbers together. The other method is the maximum pool depth, or MPD, which is simpler. It's just a measure of the single deepest pocket they can find. Both work, but AFI is generally the standard.
But measuring the fluid? That's just step 1. After that, the real detective work begins to find the cause. Doctors will talk to the patient about any symptoms, maybe do an exam to check for fluid leaking, and use a really detailed ultrasound to look at the baby's growth, kidneys, and blood flow. They even have simple tests they can do to confirm if the membranes have ruptured.
So, once the diagnosis is confirmed and they have a good idea of what's causing it, the focus shifts to management. And this is so important. The care plan is never one size fits all. It's tailored specifically to the reason behind the low fluid.
Let's really zero in on the 2 most common situations that doctors have to manage: when the membranes rupture before term and when there are issues with how the placenta is working.
So, if the water breaks before 37 weeks, it becomes a balancing act. The first thing they'll do is give a course of steroids to help speed up the baby's lung development. They'll also use antibiotics to lower the risk of infection. Then, the goal is to try and deliver the baby somewhere around 34 to 36 weeks, finding that perfect sweet spot between giving the baby more time to develop and keeping them safe.
Now, if the issue is with the placenta,
The game plan changes. It's all about really intensive monitoring. Doctors will keep a close eye on the baby's growth. They'll use special Doppler scans to check the blood flow in the umbilical cord, and they'll use heart rate monitoring, called the CTG, to make sure the baby is handling the situation well.
And based on all of that data, the whole point is to figure out the best possible time for delivery. Essentially, getting the baby out before the placenta can't support them effectively anymore. Because in this case, the low fluid is a symptom of the real problem. That's why delivery, often planned for around 36 to 37 weeks, becomes the solution.
So what does this all mean for the outcome? Let's talk about the prognosis and then wrap things up with the biggest takeaways from our explainer today.
This is probably one of the most important things to understand. When this is diagnosed makes a huge difference. If very low fluid is discovered early on, say in the second trimester, it can seriously interfere with the baby's lung development, and that, unfortunately, carries a poor prognosis. But when it's found much later in the third trimester, the outlook is generally much better, and really depends on the specific cause and that careful management plan we've been talking about.
All right, so let's boil it all down. First, oligohydramnios means fluid below the 5th centile. Second, it's usually caused by a problem with the container or the supply line, ruptured membranes, or a struggling placenta. Third, the outlook has everything to do with when it's found. And finally, the treatment isn't about refilling the fluid, it's about careful monitoring to pick the safest time for the baby to be born.
And that really leaves us with a final thought. Understanding the what, the why, and the how of a condition like this is incredibly empowering. It can help turn fear and uncertainty into understanding, and it helps you and your healthcare team work together as better partners. Thanks for joining us for this explainer.